Fidaxomicin, detailed drug information. 1 generic name, drug class, drug forms, brand name. Generic name, Fidaxomicin. Drug class, macrolide antibiotic, narrow spectrum, bactericidal. Drug forms, tablet, 200 milligrams, film coated, oral suspension, 40 milligrams per milliliter after reconstitution. Brand name, difficile, United States. Difficile, Europe and other regions. 2. Definition. Fidaxomicin is an orally administered narrow-spectrum bactericidal macrolide antibiotic specifically used to treat Clostridioides difficile infections, CDI, a serious bacterial infection causing diarrhea and colitis. Unlike broad-spectrum antibiotics, Fidaxomicin selectively targets C. difficile, thus preserving the normal intestinal flora and reducing the recurrence of infection. 3. Mechanism of action. Fidaxomicin works by inhibiting the sigma subunit of RNA polymerase, thereby preventing the initiation of transcription and subsequent bacterial protein synthesis. This inhibition halts bacterial cell growth and replication, ultimately leading to bacterial cell death. Target: C. difficile, bactericidal. Spectrum: very narrow, minimal effect on normal gut flora, e.g. Bacteroides species. Absorption: poorly absorbed systemically, acting locally in the gut. 4 indications. Approved indications. Treatment of Clostridioides difficile associated diarrhea, CDID, in adults, pediatric patients aged 6 months. Clinical benefits. Lower rates of recurrence compared to vancomycin, minimal impact on commensal intestinal flora. Off-label research use, under investigation, recurrent C. difficile infections, use in immunocompromised or elderly patients. 5. Contraindications. Known hypersensitivity to Fidaxomicin or any of its components. Severe systemic infections, ineffective due to poor systemic absorption. Use caution in patients with previous macrolide allergy, rare cross-reactivity. Before taking this medicine, precautions. Inform your healthcare provider if you have a history of allergic reactions to macrolides, e.g. erythromycin, azithromycin, you are pregnant or planning to become pregnant, pregnancy category B, animal studies show no harm, human data lacking. You are breastfeeding, caution advised. You have severe hepatic impairment. You are taking other medications, especially P-glycoprotein inhibitors, e.g. cyclosporin, other antibiotics or probiotics. How to use. Oral tablet, 200 milligrams. Take by mouth, with or without food. Swallow tablet whole. Do not crush or chew. Oral suspension, 40 milliliters, shake well before use. Use a dose measuring device, oral syringe or cup. Store reconstituted suspension in the refrigerator. Discard after 12 days. Important. Complete the full 10-day course, even if symptoms improve earlier. Avoid using antidiarrheals unless prescribed. 8. Dosing information. Adults and adolescents, 18 years. 200 milligrams orally twice daily, every 12 hours for 10 days. Pediatric dosing, 6 months to 18 years, 16 milligrams per kilograms per day, divided into 2 doses. 12.5, 8 milligrams per kilogram dose twice daily. 25 kilograms, 200 milligrams twice daily, same as adult dose. Renal and hepatic impairment. No dose adjustment necessary in mild to moderate hepatic or renal impairment. Use with caution in severe hepatic impairment. 9. Missed dose overdose. Missed dose. Take the missed dose as soon as you remember. If it's almost time for the next dose, skip the missed dose. Do not double dose. Overdose. Overdose is rare due to poor systemic absorption. Potential symptoms: severe gastrointestinal upset, management, supportive care and symptomatic treatment, call poison control or seek emergency care. 10. Stop or avoid taking Fidaxomicin if you develop signs of an allergic reaction, rash, swelling of face, lips, tongue, difficulty breathing, severe or bloody diarrhea, not improving, directed to stop by your healthcare provider. Symptoms worsen or recur despite completing therapy. 11. Side effects, detailed. Common side effects, U1%, nausea, vomiting, abdominal pain, flatulence, constipation. Less common, 1%, anemia, increased liver enzymes, ALT, neutropenia, GI hemorrhage, dehydration from diarrhea. Rare but serious, hypersensitivity reactions, rash, pruritus, angioedema, dyspnea or wheezing, liver dysfunction in patients with pre-existing hepatic disease. Pediatric considerations, generally well tolerated, side effects similar to adults, but vomiting and fever slightly more common. 12. Vital information, narrow-spectrum antibiotic that preserves gut microbiota, reduces recurrence of C. difficile infection better than vancomycin. Poor systemic absorption acts locally in the gut, not suitable for systemic bacterial infections. High cost may limit accessibility. Safe for use in immunocompromised and elderly patients. 13. Other drugs that will affect Fidaxomicin. Due to minimal systemic absorption, drug interactions are uncommon, but use caution with P-glycoprotein inhibitors may increase Fidaxomicin levels in GI tract, cyclosporin, verapamil, ketoconazole, amiodarone. Drugs affected by gut flora. Fidaxomicin spares normal flora, so probiotics may be used concurrently with caution. Less impact on oral contraceptives compared to broad-spectrum antibiotics. No significant interactions with warfarin, statins, antiepileptics. Common Syriac name, generic nihomycin, brand name difficile, class macrolide antibiotic, indication C. difficile associated diarrhea, dosage 200 mg for 10 days, route oral, tablet suspension. Common side effects, nausea, vomiting, abdominal pain. Serious effects, hypersensitivity, neutropenia, GI bleeding. Contraindications, hypersensitivity, systemic infections, pregnancy category B, drug interactions. Minimal, monitor with PGP inhibitors. Thank you. Have a nice day.